Good afternoon and welcome to the Assembly of Osteopathic Graduate Medical Educators, or AOGME's webinar entitled An Overview of Your Research Project. My name is Alenta Long, Executive Director of AOGME, and I'll be your moderator for today's webinar. We're pleased to feature Dr. Mark Speicher as our speaker today. This is the third webinar of a four-part series focused on scholarship and research topics presented by Dr. Speicher and Dr. Suporn-Braaten to the osteopathic medical education community. You can learn more about the AOGME webinar series at acom.org/AOGME. A few housekeeping notes before we get started. This webinar is being recorded. The webinar recording will be posted on the AOGME's webinars webpage within a few days. All webinar participants are now in listen-only mode. Please make sure your computer volume is turned up. The audio for today's event will be streamed through your computer speakers. If you experience technical issues during the webinar, please use the chat feature and raise your hand and we will assist you. If you have questions during the webinar, please feel free to submit them anytime through the chat feature. If time remains, questions will be addressed either during or at the end of the presentation. I will now briefly introduce Dr. Speicher. Dr. Mark Speicher is the Senior Vice President for Medical Education and Research at ACOM. Most recently, Dr. Speicher served as Associate Dean for Academic Affairs at the Arizona College of Osteopathic Medicine, ASCOM, from 2007 to 2018. Dr. Speicher's previous research at ASCOM focused on improving student performance and outcomes. His research also explored the impacts on patients from the quality, number, and specialty choice of the physicians trained at ASCOM. He has taught and lectured students on topics including clinical case simulation, biostatistics, and COMLEX and USMLE performance. Dr. Speicher's research has secured several research grants, including from ACOM and the AOA. Dr. Speicher received his doctorate in public administration from Arizona State University, his master's in health administration from Duke University, and his bachelor's in social work from the University of Akron. Again, we're very pleased to have Dr. Speicher with us today. I'll now turn it over to Dr. Speicher.
Thank you, Alenta, and welcome everybody to our webinar on an overview of your research project. I'm really grateful to be with you today in the spirit of Thanksgiving, and hope that you all find this beneficial and that it inspires you to start 2020 with a research project in your pocket that you can accomplish during the course of the coming year. So that's our goal for this session today. Specifically, first I'll declare that I have no conflicts of interest in this presentation, and I encourage all of you to contact me. My contact information is available on the ACOM website. And I want you to have my email address as well so that you can ask me questions about your research or about my research or about any research, quite frankly. Today we're going to discuss really the whole cycle of your research project. We're going to talk about developing research opportunities and research questions, finding research mentors, and we won't do too much of an interactive exercise today, but we will sort of try and answer any questions you have on finding research mentors, developing proposals for IRB approval, conference sessions, or abstract submissions, and proposals for funding. And we'll talk about the difference between those proposals during this session as well. Finally, one of the things that I've noticed that really intimidate early researchers or even mid-career researchers is talking about the data analysis or planning for the data analysis. So right towards the end of this presentation, we'll have a little bit of a guideline for how to make your plan for the data analysis. For those who haven't done research before, I know that research can be an unfamiliar process. You can see this is the hierarchy of evidence that people often refer to. SR stands for systematic review. A systematic review is a summary of other research, and by looking at several studies instead of just one experiment or one analysis of data, A systematic review gives us better evidence than we can get in any single study. Below that is the randomized controlled trial. Below that is a cohort study, so a study of a single group of people, generally over time, but not always. Sometimes it's cross-sectional or one point in time. Case control studies are where we pair someone who has an exposure, and that exposure might be to a disease, it might be to an injury, it might be to an intervention. So an exposure can be a good thing. We're doing an intervention, for example, on our students with certain study methods for their complex examinations, for example. It can also be a case report or series, and then the lowest level of evidence is expert opinions. But expert opinions are the foundation of all the evidence, because what is research about? It's about testing our opinions. And so if we didn't have opinions or questions, we wouldn't need to do research. Even though research can be intimidating, it's really things that we always do when we're treating patients or teaching students, or even sort of operating an intervention or operating part of a school or a residency program. New research or investigation topics are literally everywhere. Questions that come up to you during the day are things that can be researched. So once you have a question that you're interested in answering, then you have to plan how to answer that question. And that's what research is about. This session is specifically about how to plan answering a research question. I encourage those of you that are new to scholarly pursuits to seek the help of a research mentor, and we will talk about that in just a minute. But once you have a plan to answer your research question, then collect your data and follow your research protocol. And we'll talk about writing your research protocol as well. If you're writing a review of existing research, then that's what drives the paper, is your search for that existing research and what you find. Once you have written up your research, it's time to get it out there. And writing an early draft of a paper for publication allows you to identify and address weaknesses, sometimes when there's time to still fix the weaknesses. One of the most frustrating things is to do some research and get comments back from reviewers that you could have fixed during the data collection phase. And finally, it's time to sort of press the button and submit. That might mean submitting a paper to a peer-reviewed journal. It might mean submitting an abstract to a conference. It might mean submitting a session to a meeting or a convocation that you attend. It might mean submitting a grant proposal. So there's all sorts of ways to get your ideas out into the larger world. Your college, if you're affiliated with a college, sometimes your hospital, depending on how large it is and how many resources it has, and AOGME all have resources that we want you to take advantage of. If you work in a hospital that does research regularly, or if you work in a college of osteopathic medicine, it is very likely that you will find an office of research in the hospital or in the COM that includes an IRB. An IRB, an institutional review board, has the job of ensuring that the risks due to research to patients and students and others, the risks due to research are worth it when we think of what the potential findings of the research are. And they're there to preserve the privacy, the confidentiality of information, and the safety of those people involved in research. University libraries are great sources for people who want to learn how to do a better literature review. Their librarians know how to help you. They know how to start and how to end a literature review. They know when you have enough when you've found enough in the literature review and it's time to sort of move on to the next step. In working with students, they're pretty good at finding things that are interesting. They're not very good at knowing when they have enough for their research, and we'll talk a little bit about that later. You might have some expertise that's available to you outside your COM. So if there might be researchers in your hospital, there might be researchers in your community that will share their expertise with you. You might have resources on the faculty of your College of Osteopathic Medicine if you're affiliated with a college. You might have resources on the staff of your hospital if you're affiliated with a hospital. And finally, you probably have more knowledge than you think in directing your research project. Developing a research project is a cycle. And because it's a cycle, once you're able to step into the role of a researcher, you will never again think, I can't think of what to research, because you'll have a constant stream of ideas bombarding you literally from all sides. So the first time you do research, you need to come up with a research idea, and that's the box starting developing your project ideas. Once you have an idea for research, it's time to start a research plan. If I decide to measure how well my students are learning to do a patient handoff, or how well my residents are doing a patient handoff, right? That's my idea. How well are the residents in my program doing a patient handoff? I need to start a research plan. How are we going to measure what that handoff looks like, and how are we going to tell if it's a good handoff or a bad handoff? I might have some ideas on that myself, and I can jot them down as a part of my research plan. But then what I really need to do is take a look at the literature and ask myself, how have others measured patient handoffs? And how have they assessed the quality of the patient handoff? Is there anything from what they've done that I can use? Keep in mind, when I say that I can use, it doesn't mean that you are plagiarizing their work. It means that you are either adapting what they've developed in their work or trying to replicate it. We have a long tradition of replicating research, and that is called reliability. If I have sort of the same program on my campus, how reliable were the findings of that program elsewhere? So can I apply them? Can I generalize them to my population? It's always interesting to determine whether or not we can, for example, generalize findings in MD colleges to DO colleges, or in large residency programs to small residency programs, or in, say, medical subspecialties in residency to surgical programs. So it's really trying to generalize research findings is one of the most important things we do. And the concept of research bias is founded on how generalizable are my findings. But one of the ways we try and generalize findings in a research project are to try them on a meaningfully different population. And so just because someone else did it already, if you're looking to do it in a different group, that's probably a study that's worth doing. After this seminar is over, you'll have access to a guide that we've developed for you at AOGME that helps you sort of go through the steps of a research project. And the first part of the quick reference guide is developing your research question. There's a longer webinar available on developing research questions, but we want you to develop questions that are clear. That means that someone else can understand your research question and it doesn't take you too many sentences to explain it. That are interesting so that you'll persevere through the project. Some of these research projects can be very long. I'm working on writing up a study now that we started about 18 months ago, right? So you have to have the ability to persevere through thick and thin in your research. So you want to make sure that it's something that you're interested in, that your research question is important so that other people will find your research question helpful to them, and that it's answerable. There are many, many questions in the world that we don't yet know how to answer. Certainly we can answer more of them than we could a couple decades ago, but we want to make sure that you can answer your research question. And you will certainly write a number of drafts of your research question as you refine it through your review of the literature and in discussion with colleagues, because as you can see, this is a cycle, not a stepwise plan. And so you develop an idea, you write a plan, you do a literature review, you talk with colleagues, you develop some expertise or consult with experts in the field, and that informs your research question. Maybe I need to change it a little bit. Maybe I need to do something different in my research plan. So this is definitely a cycle and not a straight line. So think about, when you're developing your research question, think about what you do. Why do you do it? Why do you do it that way? Why don't you do something different? And what evidence have you used to decide how it is you do? For example, if you work in a residency program or in a medical school and you are implementing some wellness programs for your students, why would you implement a mindfulness program rather than a day off? Both of those programs have been studied in the literature, right? So why would you implement one over the other? Well, you would probably want to implement the program that, number one, is logistically feasible at your institution, and number two, has the best evidence, right? So why did we decide to have a meditation room instead of a group relaxation room or a game room? Why did we decide to do that? What evidence did we use to develop that approach? Those are research questions. Is our mindfulness program increasing wellness? That is a research question that can be measured, that's clear, and that has an answer, right? Is our wellness program improving student outcomes in other areas? Is it having an effect on patient care? Is it having an effect on student performance as measured by assessments in class, right? So those are all research questions that just might be based on something that you've recently started doing in your organization. Then it's time to put your question in the larger context of research. Research is pretty recipe-driven, right? There's always a research question. We always talk about what do we already know about the research question. How are we going to answer the specific question that we've asked? And what are the methods we're going to use to answer it, including what statistical tests are we going to use? What are the results of that test of our question? And what is the meaning and the importance of the finding that we've just made? If you picked up a research paper in any journal, you could find these sections in that research paper. Even if it's a paper about qualitative research, it still has the same sections and the same structure. So, use the recipe to drive your research plan. Because you know that this is going to be in your final paper or poster or presentation or grant application, you know that all these sections are going to be in all of those things. So that's what we're planning for right now. We're using this recipe to plan our research. Is your question novel? Is it interesting? Is it important? We tell this through the literature review. if there's too much to read to determine if your question has already been answered in the literature, that means your question is not clear or too broad enough. If your question is too broad, you'll find too many articles that answer parts of your question, and that means it's time to narrow your question. If there's already an answer, does the answer apply to your patients or your students? If I was recently reading an experiment, an intervention for cancer patients in Sweden, right? And they were discussing it at a journal club in Arizona where I was visiting, and they were discussing that paper as if it certainly applied to their patients in Arizona. Well, the Swedish patients were older, whiter, and wealthier than the patients that they were treating in Arizona. So there's some question as to whether or not that research is applicable to the patients in Arizona. If they were going to implement that research here, it would be worth asking the research question, does the finding in this group of Scandinavian patients also apply to my patients here in Arizona? And that's an answerable research question. So look for clues about what your methods are going to be, what survey instruments or what assessments you might use. Look for those in the literature review as well. So there's a lot that you can learn from a literature review, not the least of which is getting additional ideas for research. So as I mentioned before, there are two main types of research, and although quantitative research is the most widely done and widely published research, qualitative research, which is research about sort of commonalities or differences among groups, especially groups of people that are described more by words than by numbers, right? Even though that research is less common, it is very valuable. And there are many journals that are issuing calls for paper right now that are much more oriented towards qualitative research. And so if you are doing things in your setting, in your residency or in your College of Osteopathic Medicine that include things that you want students to perceive, right? How do they perceive the culture of patient safety? Do they feel safe coming forward with a mistake that was made on with a patient? That is much more suited to qualitative research than quantitative research. The highest quality research, of course, is research that includes both themes, not necessarily in the same paper or in the same project, right? But research that has both a qualitative and a quantitative component. And I would urge you to entertain both of these components as you're trying to decide what your research project is going to look like, because in many cases, you can answer the same research question both qualitatively and quantitatively. You can categorize your research question into three main types. You can talk about the characteristics of a group. Let's say you just started a campus in an underserved area, or just started a hospital in an underserved area, right? What are the characteristics of my patients who come in seeking OMT to my new hospital? That is an interesting research question, especially for others in areas where they serve the underserved. The second type of questions are relational questions. Which is more common? If two diseases have the same, for example, presentation, do they have the same etiology? Is there a pattern to the way my residents respond to an angry question, or to an angry patient, I should say? And then finally, one of the most difficult kinds of research is causal research. So what is the effect of smoking on health, right? That's research that it took years to answer. What is the effect of something? What is the association, right? Those are very common research questions, but require the most sophisticated statistical analysis. Now, just because I said statistical analysis doesn't mean that you can't do it, and we'll talk about that later. So once again, in the reference guide, there's a little summary of how to do a literature review, and I urge you to take a look at it because literature reviews are very important. So articles that you'll find in your literature review will serve as a guide for getting your own research published. They might provide tools like evaluation forms or survey questions or other things that you can use, and they might give you suggestions for what statistical methods to use, right? So when you're doing a literature review, I urge you to consult a librarian if you have one available. But if you don't have one available, use PubMed as your starting point and look for articles that are relevant to your research question. Once you find a relevant article, even just one relevant article, if you click on the title, you can see the medical subject heading terms or mesh terms, and you can see other articles that have quoted that article, and you can see similar articles right there in PubMed. So it's a pretty easy way to do your literature review, or at least to start your literature review. If you are writing a research plan that includes a number of variables, which are also called study endpoints, right, then it's important to research those study endpoints to see how others measure them. So if you're talking about student well-being, there are a number of surveys or, quote, tests, written tests of student well-being. There are a number of behavioral observations of student well-being. So you want to decide what kind of measurement you're going to use for each of the variables that you're studying. You want to also look for research that explains the relationships between your variables, and that's going to be the highest sort of return on your literature review investment. And then by looking at those articles and looking at the categories that they fall into, okay, this category, for example, is about meditation impact on wellness. This category is about free time or exercise impact on wellness. This category is about therapeutic or counseling relationships impact on wellness. You'll be able to group them based on sort of what you've found in your literature review, and that will help you plan how to structure and write your literature review. The most common ways of ordering your literature review are topic. Less common are chronology and problem, cause, solution. Usually, literature reviews are organized by topic. Once again, general to specific topics or specific to general topics. Usually, we use general to specific order so that by the end of the literature review, we're writing specifically about the information in our research question. You can conduct a systematic review without doing any external data collection and without getting IRB approval because the information is already published. If you're looking at topics like student debt, what is the impact of student debt on specialty choice? There are more than 30 articles summarizing the impact of student debt on specialty choice. Some of them say there's no impact. Some of them say the higher your debt, the more likely you are to choose a subspecialty. Some of them say the higher your debt, the more likely you are to choose primary care. So because the findings are not uniform, a systematic review of the literature on student debt is needed, and one does not yet exist. And so if you're looking for a project that you can do without sort of going into a patient care setting and collecting data on patients, without getting an IRB review, those kinds of things, a systematic review of the literature is a great way to get into research. If you're interested in big questions in a particular specialty, I encourage you to do a systematic review of a treatment or of an intervention in that specialty and see sort of what exists about that treatment or intervention. It's a great way to get to learn more about a specialty or to help out a residency program or help out residents who want to get published but don't have a lot of time to do patient data collection. So the literature review tells the reader what has been done, what has not been done, and what needs to be done. And your research question hopefully falls under the category, what needs to be done? You are arguing why your study is important. And this is particularly necessary if you're doing a grant application or a conference abstract, so that you can tell the reader, hey, we already know all these things, but we don't know this, and I'm going to tell it to you. Once again, all the sources that you cite in the literature review should be listed in the references, and only those sources that you cite should be listed in the references. You do not need to list every source in the reference that you read, just the ones you used in your literature review. Once again, you're justifying your research question, so make sure that you do it in an organized way and in your own words and in a way that flows from what we already know to what we don't know to what we need to know. That's what the literature should do. I've included a checklist in case any of you are writing a research plan. You can make sure that you include these items in your literature review. The most important ones: tell the story of what we know and what we don't know, and keep organized, right? I encourage you to be iterative, that is, to let your continued work on your research question inform your literature review. You might need to go back and look up a couple more things, and to use your experts, especially if you have a librarian available. So then, once you've done your literature review, you can go back to your research question and say, I'm going to measure my research question this way, and I'm going to look for the following outcome. Right? What measurable variables help me test my hypothesis? And will I believe the answer? Once you've answered those two questions, and once they've been informed by your literature review, you're really ready to write a study protocol. A study protocol simply frames your research question, which means states your research question clearly in the context in which you came up with your research question, right? So it might be in a particular specialty or for all residents or for all medical students. And then it talks about what we know and what we don't know and what we need to know and why it's important. And then where you're going to get the data from to answer your research question and how you're going to test the hypotheses necessary to answer your research question. So this tells the reader what kind of data you're going to collect, how and when you'll collect it, what's your design. And in this case, a design means how are you going to answer the question? How are you going to test the hypotheses? Are you sure that the variables you've selected actually give you the answer that you're telling the reader they do? And then the easier questions are, what have other studies done to test this data? And so based on other studies, what statistical tests are you going to use? Easier is always better. The right method makes things easy. How can you be certain your method is correct? There's a couple ways. The most convenient way is to look at the current literature, but you're not always sure how the current literature applies to your data. The best way is ask somebody who knows statistics, even a little bit of statistics. That's why I gave you my email address. You can email me, hey, I have a research question. Here's how I'm thinking of answering it. Does this make sense? Right? Finding that out before you submit for publication will save you a lot of work. I encourage you to get the book, A User's Guide to the Medical Literature, because it has a lot of different kinds of descriptions of research methods in it. So you can find a study that's similar to the one you want to do in that book and take a look at how they did the analysis. So let's talk about the data analysis. Once you know what your hypothesis is and you know what your data is, then you just have to decide what kind of statistical test you're going to run, and then you get an answer. So descriptive statistics, once again, tell us about a group. If we're going to compare members of the group, we usually use a t-test or a chi-square test or some other comparison of group numbers. And then regression and other tests help us predict a result. So based on your research question, what kind of statistics are you going to run? And there's a little bit more information on here in just a minute. At the same time that you can decide on your statistical tests, you're ready to submit to the IRB. You have to submit to the IRB before, you have to submit your research plan before you start your data collection. And I apologize, this slide is a little confusing. You have to submit to the IRB before you start your data collection. Then you do your data collection. Then you submit a second report to the IRB. All right? So the first thing you do is develop a data plan that includes a research question. A research plan that includes a research question, a brief literature review that tells us what we know, what we don't know, and what we need to know. So why is your research important? That states your hypotheses, that talks about the data that you will collect and how you will test that data. Now, as you can tell, that's the same at the beginning of the research and at the end of the research. The only difference is at the end of the research, we know the answer to the hypotheses test. Otherwise, what you turn into the IRB is exactly the same on both ends of your research. Once you have the results of your statistical analysis, you're done. You write the discussion. The discussion is important because it tells us why was what you found important? Was it what you were expecting? How is it going to change the way things are done? Right? That's what we mean by important. Was it expected or unexpected? How are things going to change because of your find? Keep in mind that this is also where you talk about the limitations of the generalizability of your study. And so you also have to talk about what might keep your research from being true in all situations. And then you can take one of the 15 or 20 research questions that occurred to you while you were doing that research and start on your next research project. One of the easiest ways to get some experience doing research is to find a research mentor. I want to note that article, Making the Most of Mentors, in Academic Medicine a few years ago, and it talks about the different types of mentors. There are a couple mentors who are there to support your career or to support a profession by advancing you in the profession, right? But then there are mentors who are more like a coach that will teach you a specific set of skills, or more like what we think of as a true mentor who want to form a relationship with you, right, but want to do it centered around a mutual interest. And so you're looking for a research coach or a research mentor, someone who has a mutual interest in some type of research as you and wants to form a relationship that will help you learn research and advance in your field. If you're looking for a coach or if you're looking for a mentor, be clear. Hey, I'd like some experience in doing research in the progress of residents in residency programs. You know, can you help me learn some specific skills in data analysis so I can do that? Or can you include me in some of your projects so that I can learn from you? Those are easy requests to make. Actually, I suppose they're not easy for some people, but they're clear to the potential mentor. The mentor will know what you're asking for. In the first one, you're asking for a relatively time-limited sort of teaching relationship. In the second one, you're asking for a longer sort of take me under your wing and let's work on a few interests together kind of relationship. And so please, understand that your needs might not be the needs of your potential mentor. I've had a number of students come to me asking if I quote, had a research project for them, right? And then I have to sort out, are they interested in a particular area, or are they just interested in learning about research? Are they interested in getting a line on their CV, and so it should be done in a particular time frame? And that's fine with me. I know that not everyone is going to, be Senior Vice President for Medical Education and Research. That's fine. But if you're interested in a specific project and you need to put it in ERIS for your residency application, which means it needs to be done in July, that's a lot different than asking me, do I have a research project for you? So please, when you're talking about getting a mentor or looking for a mentor, please think about what your specific needs are. Do I need someone to teach me skills? Do I need someone to take me under their wing and help me grow? What's my time frame? What's my continuing level of interest? Or is this just sort of a single project that I need to advance in rank, or that I need to help my program get ACGME accredited? So what are my specific needs from this mentor? And then please be clear with your potential mentor. Your potential mentor will appreciate it. There's nothing more frustrating than getting into a potential mentor relationship with someone who has very different expectations about the relationship than I do. I have made cold calls to people who are in my area of research and just sent them an email and say, hey, I'm looking to get involved in this kind of research. Here's my experience. Would you mind having a phone call with me so we can talk about it? And then asking them sort of, can you teach me some of these skills, or can you mentor me, or do you know anyone who can, right? One of the best ways of getting involved in research is to see who uses the same kind of data as you. There's a lot of existing data, that's hospital data, that's government data. AOGME has a lot of data and a lot of people working on research on our data. And so, the people who control that information, your hospital, for example, might know some of the researchers that are using that data to do research, and might be able to serve as a liaison between you and those researchers. In the government, they actually have, if you look at some of the government published lists of publications using their data, most websites that offer data have those lists, and then you can take a look at the people using that data to see if they're, and then you have to do a cold call. I mean, it's a little bit hard. It involves a little bit swallowing your pride, but if you want to have a mentor, that's sort of what you have to do. So believe it or not, those are all the steps to developing a proposal. One of the things I get asked more often is, how can I find funding for my research? And then I ask, well, what is your research? And I get a relatively vague explanation of what their research interests are, as opposed to what is a specific proposal for their research. If you are doing research in resident wellness or student wellness, there are specific funding opportunities for that. If you are doing research in student progress in entrustable professional activities or resident progress in milestones, there are specific fundable research programs for that. But it's much more helpful to know your specific research idea and then look for research funding opportunities in that area. So I would encourage you to, even though this is a cycle, start with a potential proposal and then move through this area. So here's my proposal. I've focused my research idea. I've identified funding opportunities, but the funding opportunities that I've identified haven't exactly been for what I've proposed, they've been for a specific area that is similar to but not exactly the same as what I've proposed. So instead of doing an intervention, for example, that involves exercise, I'm going to test an intervention that involves sort of whole person wellness. So exercise, mindfulness, and sort of personal self-regulation, right? And so we're gonna focus on that instead because we think it's more fundable. Once you start looking for specific funding opportunities, I think you'll find it easier to see how your proposed research does or doesn't relate to what the funder has in mind. Once again, focusing your research idea for funding is just the same as focusing it for publication. So what do we know? What do we need to know? One of the differences is funders expect someone to have a little bit of familiarity with the subject. And so your first ventures into research in a particular area are not going to get funded unless your mentor has more experience than you. So another reason to find a mentor. Clarifying the question as well helps seek funding. So once again, as you're working on your project, focus your research idea. Make sure that you have the resources to do the project, and then develop a synopsis. And this is a very funding-focused thing. If you're developing an abstract for submission and it's 1 to 2 pages long, you blew it because you're going to get about 500 characters to submit an abstract to a conference. But for a funder, they're looking for something a little bit longer and something that addresses logistic and feasibility questions instead of just addressing your research question. Once you have a proposal, it's time to find your most critical friends and send them your proposal so they can ask you some hard questions. If you have the opportunity, explain your proposal to them and answer your questions on the phone or in person. This will help you make sure that you have the strongest possible proposal. AOGME every month sends out its Washington Insider newsletter that always has a list of funders on it. And AOGME itself funds new ideas and innovations in osteopathic medical education. What do we ask you to submit? Not surprisingly, we ask you to submit a couple-page funding idea with a budget, right? So if you go through this process and end up with a research plan, that is something that you can submit to many of the smaller private funders to get an initial seed grant. Make sure that your objectives align with those of the granting agency, and you can find out by looking at the call for submissions that they've issued, by looking at some previous grants, by looking at the eligibility criteria for the grant that you're interested in, and by looking at the mission statement of the funding organization. I know that I already asked you to do a cold call for a research mentor, but I'm going to ask you to do another cold call. Funding organizations will get on the phone with you to discuss your ideas. They might tell you, you know what, we're not that interested in that proposal right now. But they weren't going to be interested in it anyway, and you just saved yourself some time and some effort by finding that out on the phone. Review the guidance for the application very carefully. Funders are often, especially federal funders, private funders not so much, but federal funders are looking for ways that you didn't comply with the instructions because they get hundreds of grants, sometimes thousands of applications, and they don't want to go through all of them, right? So make sure that you know what's required for eligibility and for the expectations of you and how you're supposed to confirm that you can meet those expectations. Budgets are very difficult for researchers to write, but the line items you usually need are personnel, equipment, services. So if you need to buy a biostatistician consultant or some other kinds of consultant, that's what a service is. supplies, travel, and institutional overhead, right? Those are the main lines of your budget. And so you can certainly start creating a budget. If you're creating a budget for an AOGME grant and you need a little bit of help, AOGME will provide a quick review for you to tell you what looks like might be missing from your budget, or that your budget seems to be in line with other budgets that we've received. Your data analysis plan, once again, what are your study endpoints and your hypothesis? What do your variables look like? Are they continuous variables, or are they numbers with decimal points and all that good stuff? Are they categorical variables? Sometimes the same thing can be measured in different ways. So I can measure my blood pressure as a number, a 3-digit number, or sometimes a 2-digit number, systolic over diastolic, a 2 or 3-digit number, right? Or I can identify it as hypertension, normotension, hypotension, right? So I can do it categorically or continuously. So how are you measuring your variables? And then what is your sort of study plan? And that data analysis plan, are you comparing averages? I'm going to compare the average on an anatomy test for this year versus last year when I didn't do the intervention. I'm going to compare the performance of my students on a stress test before and after our mindfulness activity, right? So those are the ways that you can compare average performance. Sensitivity and specificity, so what's the likelihood of being positive or negative for some condition, and then of course prediction studies. So as you've seen, the overview sheet will help you frame your research, but this is just a quick outline of all the things that we talked about today to do your research plan and get it ready to make sure that in 2020 you are a researcher. If your New Year's resolution is to become a researcher in 2020, it's time now to start working on your research question and your project summary that describes your research methods, the work that's already been done by others and by you, and the dissemination plan for your research. If you're applying for a grant, you're also going to need to describe the infrastructure that you have to comply with the requirements of the grant, stakeholders that support you, and a study budget. So I encourage you to make it one of your New Year's resolutions to be a researcher in 2020. And I hope that if you have any questions, you'll share them with us now, or you'll reach out to me individually. If you are in a residency program or in a college of osteopathic medicine and you haven't done research before, there are so many resources that AOGME can make available to you, that your institution can make available to you. I urge you to reach out and to find a librarian, find a mentor, find someone you can complain to when things aren't going in your research the way you think they should be going. But I especially encourage you to reach out to AOGME for help with any of the phases of your research project. So I don't see that we have any questions, Olenta, but I think I've included my email address, and I'm happy to stay on for a few more minutes while we wait for some questions.
About the webinar.
I just want to remind people once again that research is very doable. I hope that this has given you a bit of a step-by-step process, a little recipe that you can follow, and I hope that you'll try and follow it. I especially want to reiterate that I encourage you, I really, really encourage you to reach out to me and ask me questions about your research, or ask me to connect you with resources that I'm familiar with to help you get your research accomplished. Thank you, and happy Thanksgiving.
Thank you so much, Dr. Speicher, for the presentation, and to all who joined us today. The webinar recording and the PowerPoint presentation, along with the document that Dr. Speicher shared, will be available very shortly in the AOGME webinars webpage. If you have questions or want to learn more about the AOGME's webinars, please visit us at acom.org/AOGME. This concludes our webinar. We hope you have a very happy Thanksgiving and have a good evening. Thank you.